We can show you the risk of being exposed to COVID-19 right now if you leave home and get together with others. USF epidemiologist Dr. Jason Salemi has a tool on his website. You pick the size of the gathering, let's say 30 people. You pick a county. It's in the 20% range across most of our region. Again, just based on general calculations.
It makes a lot of assumptions. It's really just a crude risk assessment tool. It's trying to translate something that can be difficult for people to understand, like the level of community spread, the number of daily cases in the past 7 days. That can be a bit abstract to some people. And so it tries to put that in a more interpretable number. And so it also just cautions against group sizes, because like if you put in 50 people in any sort of meeting right now, you're going to get above a 98% likelihood of encountering somebody who's infected.
And that's why our nation's doctors and nurses and hospitals are urging people to scale back their plans for Thanksgiving. And it's why the CDC is recommending against travel. And we have some visualizations that may help you put the risk of traveling right now in context. Keep in mind, data scientists measure the positivity rate in different ways. The state of Florida prefers to focus on rates among new cases, but the trend lines in Florida are moving in the wrong direction no matter how you measure it. Now, ProPublica compares the percentage of total tests that are positive per state, and it shows the 7-day moving average in Florida is 8.7% and rising. That's alarming, epidemiologists, and combined with other data, it indicates increasing community spread across our state. Now, compare that 8.7% to Mississippi, where it's jumped up to 20%. Compare it to Missouri, 23%. Pennsylvania, 25%. You see what's happening as we track to the north and to the west. Look at the situation in Kansas. Average positivity rate, 41%. Track northeast to Iowa. Positivity rate, 49%. Then jog northwest to South Dakota, and the positivity rate jumps to 53%. This puts Florida's troubling situation in very troubling perspective.
It was actually astonishing to me that we can be rising in cases in the last month by 130%. Hospitalizations are up 64%. And if you look at the rate of current hospitalizations for COVID-19 per capita, we're still in the lower quartile among all other states, which just shows you how dire the situation is around the United States.
Well, experts advise canceling or postponing Thanksgiving get-togethers, but knowing that many people will still meet up, Dr. Salemi says people need to make adjustments.
Communicate with one another and your families. Get a plan of action together. So if you're choosing to get together in person, are we going to do things outdoors? Are we going to wear masks? Are we going to socially distance? I think those are all the right things to do. Again, being outdoors, wearing facial coverings, socially distancing, even getting further apart if you're going to be eating together outdoors.
And if you are determined to meet with friends and family for Thanksgiving, make sure you isolate in advance and that they do as well.
Stay home before you go home. So if you are choosing to get together in person and you're going to be traveling to a loved one's house, stay home first, stay home now, before Thanksgiving. Reduce the likelihood that you are going to get infected.
Should you get a test before you join family at a gathering?
Go and get tested now. Make sure that you don't have the virus. You could be asymptomatic or pre-symptomatic. And again, you want to reduce the likelihood that if you are going to be getting together, even with these mitigation strategies in place, you want to reduce the likelihood that you're going in there infected to the extent possible. And of course, limit interactions, keep the group size small. I know a lot of people are genuinely getting together virtually. They're all cooking the same meals. They're going to be on Zoom or some other sort of video conferencing software and enjoy Thanksgiving that way, especially with, older people in the family. That's the best way to protect them. And certainly if you live in different states, that reduces the risks associated with traveling.
There's a clear correlation to collective gatherings, and there is a correlation, of course, to weather. Remember, the virus took off this summer in Florida as people gathered indoors to escape the heat. Then it took off in the upper Midwest as people gathered indoors to escape the cold. And there's clearly a correlation to people letting down their guard.
We're heading in a bad direction.
What appears to be causing this in Florida?
To be perfectly honest, it's hard to pinpoint, but I think people are just tired. I think there's been a general relaxation of the mitigation efforts that we had put in place. it takes layering of a lot of these mitigation strategies that we talk about, like wearing facial coverings, social distancing, doing things outdoors. And so I don't think it's yet the weather that's driving people indoors, especially in a place like Florida. I think it's just that we are tending to get out more. And I think a lot of people have started to relax the things that were effective in preventing community spread of the virus.
You'll find much more of our conversation with Dr. Salemi on our Facebook page and on Twitter and Facebook as well. It's good insight on what's happening and how we can work together to mitigate and suppress the virus, and with vaccines on the way, finally bring this pandemic to an end.